Second 5-minute call for the Labor Party, Lewis Wall.
Kia ora, te mangai o te whare. Tuatahi, aroha ki te whānau o Dr. Ranginui Walker, moi mai rā e te rangatira. I'm actually really pleased to take a call on the debate on the PM statement, and I really want to focus on 2 points that he made. Mr. Speaker, the first was that he said there will be a $17 billion hole in the economy. So they're already anticipating that our revenue will be short $17 billion. The other point that he made, which I just find incredible, was that in spite of that, this government is 100% focused on tax cuts. And the fact that they're 100% focused on tax cuts as part of their fiscal strategy got me thinking about what that means. And so what that actually means is that there will be spending cuts, and as such, there will be service cuts. And so I was thinking about the services that will be cut because of the government's obsession within that context to give tax cuts to people who they have traditionally, wealthy New Zealanders who quite frankly don't need it. And so what does that do to undermine our public service? The provision of hospital services, social services, services that New Zealanders need, actually, to keep them healthy and to keep them well. And I found it really interesting at the beginning of the year, on the 9th of January, actually, there was quite a big write-up and media focus on the rheumatic fever prevention program in South Auckland, which now is in its 5th year. It's actually a $45 million investment because this government, rather than provide houses so people didn't get sick, actually said what we'll do instead is we'll go and test the kids. So they're working in 61 South Auckland schools, and last year, Mr. Speaker, 20,000 cases of strep A were detected through that program. Incredibly commendable, because what that meant is those kids could get antibiotics. Why? Because if we could prevent strep A turning into something else that is rheumatic fever, then that was the government's solution to addressing this whole issue of poverty and the lack of quality housing provision in South Auckland. So I was incredibly surprised to see on the 9th of January this year that the funding that Counties Manukau DHB is receiving for this program is going to be cut by 50%. So on the 1st of July, 50% of that $9 million annual investment will go. And so it's Counties Manukau DHB's responsibility to keep funding that program that has proved effective, that has found 20,000 children who need access to antibiotics to stop them from getting rheumatic fever. Wow. So the DHB is one of all DHBs around the country, except Southland, or one of the DHBs in the south who don't have to cut funding. But actually, Counties Manukau DHB is part of a $138 million, what would I call it? The hospitals have been directed to save money. $138 million this year. Counties Manukau DHB have to save $20 million. So not only do they have to save $20 million, they're also going to lose $4.5 million of an initiative that this government has been trumpeting and has been very proud about because they're stopping South Auckland kids from getting rheumatic fever. Those are the challenges, and those are some of the decisions that get made because of the obsession of this government to tax cuts. It's meant mental health services in Canterbury, and I know my colleague Denise Roach talked about this earlier. Within the context of increased need of people in Christchurch calling out for help, we know that the helplines for young people have been oversubscribed for 5 years. What have the government decided to do? They're going to cut funding for mental health services in Canterbury. It's ludicrous. It's ridiculous. We're supposed to govern in the best interests of all New Zealanders and meet their needs. And this government supposedly have put Canterbury as a big priority, but actually their obsession with tax cuts means that they're cutting funding for rheumatic fever, they're cutting funding for mental health services, they've cut funding for women's refuge, and actually the list could go on and on and on. And I think that this budget actually is a dark day in the Prime Minister's priority, the Prime Minister's priorities, which actually will translate through to the budget, will be incredibly interesting to see. Kia ora.